fancy again.
It is very fancy again.
And it's very high.
Too aggressive. What?
I guess the table is just a lot higher, I feel like, than normal.
I'm so sorry.
I don't know.
You're the one that set it up.
I know.
Our production team set it up.
Which is me.
Crystal.
So yeah, we didn't really know what to talk about this week.
We're feeling real inspired, obviously.
Clearly. I mean, I said we should talk about like our favorite vet stories. I called another one of our tech friends and I was like, what should we talk about? And she was like, potty training and kittens, and you know, there's lots of puppies lately. So I don't know, maybe we'll just briefly touch on all the things. I don't know. Maybe we can get some questions going. I always want people to ask questions and they never do.
I'm so sorry. I mean, you would think
you're not really, though.
Everyone's just like waiting with bated breath for us to like come onto the Facebook
and answer
all of our thousands of fans, millions of people just waiting for us to go live.
I kind of felt like maybe we should start doing like these videos on TikTok too. Maybe we could be like TikTok famous.
But then I would feel like I would have to download TikTok, and we've talked about this and how that's. I know that would not be good for me.
Well, you don't have to.
I know myself, so
I've seen upload the videos.
I've seen the TikTok videos that like come across on Facebook or Instagram or something, and I know that that would just be something that would suck the rest of my life away.
Yeah. Although, I mean, I was on it for a little bit last night, but really only like 15 minutes, and then I got off. I think it wasn't too long. I did find some woman who's pregnant with triplets right now.
Gross.
She's giant. So that was exciting. I watched several of her videos.
Oh my gosh.
But
yeah, we can talk about puppies and kittens. I mean, have we talked about that before? I don't think so.
We've talked about urinary stuff, but I don't know that we've talked about like potty training and how many litter boxes to have and that kind of stuff.
Okay. So how many litter boxes do you need? Yeah.
You need to have one per cat plus one. So if you have...
That was riveting.
What else do you want me to say?
I don't know. Like I said, it's such a short. It's a short top. Like there's not a whole lot else to say.
So then, what do you want to talk about?
I don't know. You go. You talk about what you want to talk about. Tell us one of your stories. Tell us a story, Crystal.
What story?
Oh, we forgot. Hold on.
Okay.
No, first you got to do this. You got to do my favorite part.
You guys literally just witnessed our entire friendship. This sums it up. The last 3 minutes that we've been on here. I'm like, what do you want to do then? Well, I don't know. Do what you want to do. Well, clearly what I just suggested you weren't excited about.
I want to just dance. I'm just going to play different songs and we'll dance.
Okay, I'll just like hit play and then find a new song and then pause and play. That would be really fun.
But I feel like I'd have to have like songs like planned out because otherwise I'm just going to sit there looking at my phone like, what song does go next? Have like a little playlist set up or something.
Yeah, that would be fun.
We Kelly and Crystal dance party mix. Follow us on Spotify.
I'm trying to make sure that I'm keeping up with the comments because they don't always show up for us. So I'm just making sure.
I think there's like 300 comments right now. We haven't seen those?
No, there's no comments. There's one like, and there's 2 people watching. So if you're on, say hello. Hello!
Hello!
But, yeah, so what do you want to talk about then? What story do you want me to tell you?
Well, you said something about doing stories. I thought you had something
like
in mind.
Vet stories?
Yeah.
You know, one of my favorites, well, 2 come to mind when I think about vet stories. This one dog, I'll go with oldest first.
Okay.
one that pops into my head was a dog came in with this giant mass on his ear. Do you remember that?
Yeah, I remember what dog that was. Mm-hmm.
Oh my gosh. And it was giant.
It was disgusting.
It was disgusting.
It was all infected and
so bad. So bad. And it was awesome. We clipped it up.
It was awesome.
It was. I think, did we do that under local?
No, we had to knock him out because I think I took like the tip of his ear off because it was like all like, it was the whole tip of his ear.
Yeah. I couldn't remember. But it was gross.
Yeah.
And so you took, surprisingly not as much as you would think.
No.
Off of that.
No.
I mean, this mass was like this big.
I'm like a little 15, 20-pound dog.
Yeah, it was giant. And there was so much hair matted into it. And just like, you could tell it had been oozy and sealed up and then oozy again. And it was just disgusting.
Well, that's like, I mean, the guy that we did his bath today, he had stinky nastiness. So that the moral of that story is if your animal smells for no particular reason, let's get them seen.
Yeah.
Because him too, we found that big nasty mass that was all infected and awful. Yeah. So we have taken that off. And now he doesn't stink anymore.
Yeah.
Now he just normal stinks.
Mm-hmm. Yeah.
Just normal dog stink. Not nasty infected mass smell.
Yeah. Yeah, gross.
Yeah, there's still something. Overall, I don't think we don't get too grossed out by things, but there are certain things.
Yeah.
That it's just like, oh.
Like that one was bad. I mean, it was like the whole hospital smelled after that dog had been in there for a couple minutes.
Yeah.
It was bad. But she removed a piece of his ear and he healed great and he looked and he smelled so much better.
Oh my gosh, he was so much happier.
Yeah, it was awesome. And then the one we had recently with the tooth stuck in his leg.
Oh, that was weird.
Yeah. The dog had like gone missing for a few days and came back and had like this weird ulcer wound mass.
It wasn't even, I don't think there was necessarily a wound. I think it was just swollen.
Oh, the first time we saw him?
The first time we saw him, it was just swollen. We were like, well, maybe he just hurt himself. I don't know. Weird. Put him on antibiotics, pain meds. It was good for like a month, and then he came back. And then I think when it came back, I think that it had like busted open and was oozing.
Yeah. But not a ton.
Not a ton. And so we took an x-ray, and there was a chunk of a canine tooth stuck in this dog's leg. That's so weird. Yeah. So that's why it came back. So the antibiotics knocked down the infection for a period of time, but then because the tooth was still sitting in there, and you couldn't feel it because everything was so swollen. So because that tooth was still sitting in there, the infection came back. So that's why the second time we're like, we need to do some more looking on this. And so we snapped an x-ray, and we're like, that looks like a tooth.
Yeah.
And then lo and behold,
I didn't get to see it come out.
Yeah, lidocained it up, kind of squeezed on it a little bit, felt around. Out pops this little chunk of a canine tooth. There was like just the one little sore. It wasn't like there was multiple puncture wounds or anything. It was really weird. I'm not even sure how that happens. Like just one tooth goes in and then breaks off and the dog runs. I don't know.
Some force there.
Yeah.
I mean, unless the tooth is already broken, but I don't know. It was weird.
Really strange.
I'm sure I remember one from, it was so long ago, I don't even remember exactly what happened, but this dog had like a weird mangled leg, and they said they found him on train tracks, so I don't know what happened there. It was someone brought in a random dog. I don't even know if you were there. You may not have been there.
I probably wasn't there.
Probably a very sad day for me.
Yep, exactly. I cried all day because I wasn't there.
Yep.
And then you saw this dog with this mangled leg.
And that's why I remembered it, because you wasn't there.
You wasn't there.
You wasn't there.
Oh man.
What stories you got?
One of my favorite stories is just because I thought it was sad but also funny, was Duchess Story. Duchess. So there was this dog who came in, that she'd come in for limping. I don't know, maybe I've told this story before. The dog came in for limping, and we're examining this dog, and the owner's giving me some more information, background history, and things like that. And I think we went to take an x-ray of the leg and happened to see this dog has a giant pyometra. So a giant uterine infection, which our saying for that is you never let the sun set on a pyo, meaning they need surgery ASAP.
Same day.
Because what could happen is that so the uterus is filled with pus, and that it'll continue to fill and fill and fill until it breaks open, and then there's pus in their abdomen, and obviously that's really bad. So you never let the sun set on a pyo. So I went back in to talk to the owner about it, and she just like kept asking about the leg and some other stuff, and I'm like, no, like your dog needs surgery right now. Like if we don't do this, she will die. Like it took forever to get this through this lady's head. So we finally got to the point where, okay, she's okay with the surgery. We take the dog to surgery. She sat there, I think, and waited for some reason. And then when I came out of surgery, I had to go tell her that the dog was fine and that we were done. She was like, "Is Duchess dead?" And I was like, it took so long to get this through her head that her dog had a life-threatening condition. And so then she finally understood it, and then like that's all that was in her head was that the dog obviously died, and that's why I was coming out to tell her. No, she's fine. Duchess is alive.
I don't know that I was there.
It was comical. I don't know. But it was just like, trying to talk to this, like, no, you don't understand. Like, we don't care about the limping. She's going to go on pain meds after surgery anyway. It's fine. There's nothing wrong with the leg other than maybe some soft tissue. But that's not our issue here. The issue here is that she has a uterus full of pus. And we had to have that conversation multiple times before she finally was like, oh, okay.
I would not want to have a uterus filled with pus.
No.
I will tell you, do you remember, I don't think this is
I'm not sure where this is going. Oh. Okay. I don't
do you
know.
think I was going to talk about my uterus?
About you having a uterus filled with pus. I don't know.
No. Gross. No, that dog that you could see the abdomen was like clearly distended and large, and we took that uterus out of the dog, and it was like almost as big as her.
Mm-hmm.
Oh my gosh, it was awful. And it has to be so uncomfortable and make you feel so miserable.
Yeah. Spay and neuter your pets, folks.
Yeah.
Because you know what prevents that is not having the uterus.
Mm-hmm.
So
100% preventable.
Yeah. Get rid of it. You don't need it.
Yeah.
You don't need that.
You don't need that. Tell the tater story. Importance of appropriate e-collars. Okay. We had a dog come in. I was not actually working that day, but surprisingly enough, one of my dogs.
I was very sad.
You were.
I was crying that day.
And so one of my dogs had a seizure, so I brought him up for blood work on a Sunday. And we had a dog come in that the intestines were hanging out of her body because she had gotten her abdomen open. So she had been spayed. I assume wasn't wearing an e-collar or
no, she came in wearing the collar.
Did she? Okay. So it just
yeah, I don't know. I honestly don't know because it didn't. I mean, obviously we didn't like take the time to like measure and evaluate and stuff. But I think when the dog came in, it still had the e-collar on and it was like covered in blood. So I don't know if she was just still able to get to her incision or if she got a foot up in there or I don't know, something. But she'd been spayed, like wherever they got this dog from, and it just come to live with these people, super nice people. Dog was in a kennel with the cone on, like they should have been. They went out to like breakfast or something, came home, and there's like blood all over the place. And they came rushing her in. Yeah, all, like her intestines were all hanging out of her belly, and there was the blood was coming from partly because some of the loops of intestine, the blood supply had been like ripped off of the edge of it. So along like the edge of the intestine, there's a blood vessel that runs, and it kind of loops around, and it goes along the intestinal loops like that. And so it like had like pulled off of part of it, and that's what was bleeding. So we had to remove that section of intestine. Somehow she made it through surgery. She did great.
Yeah.
She's fine. She's alive.
I mean, it's just...
It was shocking.
It's crazy to me, the amount of people that think the cones aren't necessary or they just don't want to put them on.
Yeah.
I'm like, okay, well, that, you know, for a neuter, it's not as big of a deal. Their intestines aren't going to be hanging out if they get their incision open. It's still not great. It still requires usually a second surgery depending on the extent of damage that they've caused to themselves. But especially for a spay or some sort of a abdominal surgery, there's an opening straight to their abdomen, straight to their belly. So if they get through those stitches, everything just gonna fall out. I mean,
and it's amazing. Even though we got to her and got surgery done, I mean, there was still the risk, obviously, of severe infection and sepsis and things like that because that was all open, and obviously now her whole abdomen is contaminated. And you know, we flushed it out, we did antibiotics, things like that. So doing everything that we can, but still a big scary risk. So I was shocked that she lived. Honestly,
I have another story. That dog with the awful teeth.
The one with the tooth.
Huh?
The one with the tooth?
Oh, no, not that one. That one was funny, too, though. This dog went to, like, yell at us, and his tooth popped out of his mouth.
His canine tooth.
Yeah, and we were just like,
like
who did it?
Heaven. Who touched that? Nobody.
Nobody touched it.
It was just like barely hanging in there, and he just like his tongue hit it or something, and yeah, out pops this canine tooth. Which
canine was so funny.
Teeth, the length of the tooth that you see outside, outside of the gum line, there's at least that much, into the bone. So for that tooth to just come flying out of a dog's mouth,
that's really funny.
That's not okay. Those teeth were nasty. I think we ended up doing full mouth extractions on him.
Yeah. I was like, what did you do?
Yeah.
Oh, man.
Touch him.
Not that one, but that one was funny, too.
That's the one you were thinking of.
The one that just had, it was the dachshund with the horrific mouth, and he had the bone cancer, like the big, giant bone loss cancer spot. And that lady just could not understand why we were so upset that it wasn't being addressed. And she had taken him like several different places, but I mean, his teeth were so bad. There was so much hair and gunk and food and grass and everything up in his teeth. Oh, it was so bad, and so much root exposure on those teeth.
So let's just like rule of thumb: dachshunds, Chihuahuas, Yorkies. Anyone else we want to add to that list? They need a dental cleaning at least once a year. Whether you think they do or not, they do. They do, because those are the ones that get the most train wreck mouths and so much infection and just disgustingness. Plan on getting them a dental once a year.
I mean, especially if you want them to keep most of their teeth, because I will tell you, my Chihuahua gets a dental usually like every 8 months. It's like 10 to 14 months I'm getting him in for a dental. And last time, I think he still lost 2 or 3 teeth. Didn't he last year?
I think so.
Yeah.
I think it was a couple.
He still lost a couple teeth. And I mean, he gets his teeth done religiously.
Yeah.
He's a Chihuahua. He's a train wreck. He's just a train wreck of a person anyway.
Yeah.
I caught you guys live. Any options on supplements for skin or coat? Any supplements for skin or coat?
So there's a couple different supplements for skin and coat, depending on what's going on. So if you just have like a dog or a cat that has like some dry skin, or maybe they just shed a little bit more than what you think maybe they used to. So omega fatty acids are your best bet for that, so like fish oils. And they take quite a high dose. So definitely something to get an actual dosage on, make sure you're giving them enough. And then there's actually, so if you have an animal that has allergies, there's a product called Dermaquin that has come out recently for that, to help with that. Crystal and I have both been using it on our own dogs, You think it's helped, right?
Oh, yeah.
Yeah.
I mean, Jace is completely off of his Apoquel.
Nice.
I mean, he did have to take it for like a few days because he got real itchy.
Yeah.
When the weather started to change, but he's been on it. I think this is my 3rd bag, so he's been on it like less than 6 months, but more than like 3 months. And he's completely off of his Apoquel. His skin still gets red looking and irritated, but he's not itchy.
Yeah, I believe it has some kind of like kiwi extract in it that's supposed to help with that. And like Crystal said, the goal with that is we'll typically start them on that along with their allergy meds. And then after they've been on it for a month or two, try tapering down off of their allergy meds and see if we can either get them off or get them on a lower dose. It's a flavored little chew thing, super easy to give.
Oh, yeah, he loves it.
I just drop it in my dog's food. So yeah.
Jazzy is still chewing on her feet with new food.
Yeah, so that would be, it would be something to try. Can't hurt.
Yeah. I mean, my dog was so bad. I mean, he was on Apoquel every day for like 3 years.
Oh, yeah.
At
Lana's
least
been
3
on
years.
Apoquel for like life.
Yeah, at least 3 years.
Yeah. I will say, I haven't noticed as dramatic of an improvement with her. Like, I haven't been able to get her off the Apoquel, but it helped her symptoms doing them both at the same time. Because the Apoquel haven't been cutting it alone anymore. So I actually just started her this past week on immunotherapy. But that takes like a year, 6 months to a year to see improvement. So I'm still having to do something in the meantime to keep her comfortable. So, yeah.
You're very welcome. We do sell the Dermaquin here.
Yeah.
We've got like an immune support as well called Immuquin. But we don't have like fish oils here.
We have Willactin.
Well, Willactin, yeah, we do. So yes, we do.
all of the above. All of the above. Yep. Partly because we use them on our own animals.
Yeah.
Yeah, my dogs get the Willactin, which is the omega fatty acids. They get that every day. So Lana gets it because of her skin. My other 2 boys, so Rigger and Henry, get it for joints. So it does both things. So that's cool. It has anti-inflammatory effects, which is wonderful, and helps keep skin healthy.
Yeah. Let's see, what else? What else can we talk about? Gabby says Diego gets a dental twice a year these days.
Yeah.
Yep. He's getting older.
Yeah.
And
we
he's
need
a
dog
dachshund.
So.
So
Diego.
Poor guy.
He's so cute. I love her Snapchats of him.
See what else? What else you got? I've told several stories. Like, what's one of yours?
I don't do anything else interesting.
Are you gonna pity party? Like,
yeah.
You work 6 days a week. Surely you have cases to talk about.
That's why my brain is fried.
Well, that's fair. You got new glasses?
I do have some new glasses. Yeah, I got a few pairs of new glasses. And these are really fancy. So, shout out. It's too bad we're not, like, cool enough that we actually have followers that, like, people would want to sponsor us. Because Zenny Optical, man, I buy all the glasses from there. These have, like, an anti-fog coating. And it's actually really working. For people that have to wear glasses with masks on, it's awful. It fogs every 2 seconds. It's the most obnoxious thing in the world. These actually, they have an anti-fog coating, and I was like, well, I don't know, we'll see. But it was like extra $12 or something per pair of glasses. And what?
These glasses were $6.95 from the Zenny.
Well, but still, so exactly. Like, I think that this was probably like, I don't know, like a $20 frame or something like that. And then I added on the anti-fog coating and stuff. So, I mean, you're still less than $50 per pair of glasses. Okay.
These were $6.95.
That's why I have like 300 pairs of glasses.
That's true. And she was looking at more yesterday.
I was.
So.
Cats are here. Cool.
Thank
awesome.
you.
So,
all right.
There are cats here, apparently.
There are.
So we're going to go see them. Maybe next week we'll be better prepared. You never know.
Probably
no
not.
promises. Probably not.
Yeah, I called Gabby and was like, hey, what should we talk about in our meeting, in our Facebook Live? And she's like, oh, when are you guys going live? And I was like, probably about like 10 or 15 minutes.
As soon as we get set up.
Oh,
as soon as we have a topic.
Last minute, huh? I'm like, you know it.
That's how we roll.
Always.
Well, there's stuff during the week where we're like, oh, we should talk about that, and then we don't remember what it was.
Yeah. People probably don't care anyway.
Someday we'll write down the ideas like adults.
I've been a really good adult lately, so I don't even want to hear it.
Okay. Well, I'm going to go see Cats. Do you want me to just leave you here? You want to
I'll just
talk to everyone yourself? Okay, bye.
Are you going to pay me to just sit here and talk?
No, you got to go do work.
Oh, okay. All right.
All right, everyone. We'll see you next week. Bye. I mean, you left me here to talk by myself last week.
I did.